Hi everyone, I'm GREYMOND. This is OCD Q&A. So we're going to be answering questions. If you would like me to answer your question on OCD recovery, please leave it below this video or any of my other videos, and I will pick it up on the next show. Before we start, I just wanted to go over a topic that is getting increasingly worse, and this is emails. Guys, as somebody who's gone through OCD myself, and just to reiterate, my OCD was so bad I couldn't leave the house. So it wasn't like a mild case or anything like that. No, it was severe. I was on the highest dose of medication, so it was severe. What I wanted to say is I understand how difficult it is, but I cannot help every single person who is writing me an email. And because what is happening right now is I'm getting emails that are page long, and I have like about I can never get to inbox 0 or anywhere close to it because of the amount of emails I'm getting of people just wanting help over email. Help is available. The recovery program is available, but I cannot provide recovery program style help over email. And I understand that a lot of the times there's financial problems, or you feel like you have no other options, or you feel like you can't do the program. But what can I do? I'm one person. I'm the only one who's seeing these emails, and in every email people are asking me for help, and it's for me just to read through the emails that are a page long. Can you imagine how much time of the day it takes, in addition to doing 8 hours a day of helping clients? So I understand the situation. I understand that everybody needs help, and I'm trying to do my best to help everybody as much as I possibly can. The program is always available on youhaveocd.com, but I cannot provide program style help in email. I can answer questions on here if you have a question, but in terms of going back and forth, because this is the other problem, is that if I answer a question, I read through the page, answer the question, another question comes up, and it just goes over and over and over again. But it's not with one person, it's with 100 people. And more people are coming every day and messaging me. So let's be respectful, and let's try not to, just get free help, in that kind of sense, because don't get mad at me that I cannot reply to every email, because I can't get to them because people are wanting my help through email. So, this is just, I'm telling you guys, how it really is for me. And I hope you understand that, for me to provide help, and the other thing is, if you want me to help you recover through responding to your email, how much help is that really going to be? To recover, you need continuous support. You need to be on a very strict recovery program, or you need to do it yourself. Me answering a few questions in an email is much less than you will probably get from any of my OCD Q&A shows. It's mostly done for reassurance. And again, reassurance is never a good idea. I know it feels like you have to get reassurance, and it would be so good if Ali could just clarify this one thing, but it's not productive. So it's, if you need additional help, the recovery program is available. You can't do the recovery program, do the recovery program by yourself. So listening to these shows, applying what I'm saying, and pushing through. You can't do this. This is not magic, You do the work, you'll recover. You don't want me to push you, then push yourself, and just push and push until full recovery. That's all you need to do, and you will recover. So anyways, this is just kind of a little bit of a sore subject for me, because every time I open my email box, I'm like, oh, because there's so many emails coming in, and it just gets more and more and more. And because I'm in sessions all day, I can't really even get a chance to answer the emails. As you can see, I'm already a day late filming. So it's, just if you guys can bear with me on that subject. So anyways, having said all that, and frying your brain with all of that, let's get back to questions. So first question is, how do I deal with OCD and having a newborn? It's very hard due to the new worries that come in and the lack of sleep. Please help. So, okay, first of all, I don't know why it is, but I actually have a lot of clients who either about to give birth or just gave birth or new parents. So this is a very common area of expertise for me. So with that, first of all, sleep. Of course, I understand that, nobody can get enough sleep when having a newborn, but if you even nap, you need to give your mind time to rest. If you guys can take turns, so you say your wife is sleeping at one time, then you're sleeping and taking turns that way, figuring out a system that works. But you need to sleep because your mind is overworked with OCD stuff, and on top of it, you're pushing it further by not sleeping. Add coffee into it and you have a whole setup, to have an OCD attack. Right, so you have to find a way to get at least a little bit more sleep. In terms of new fears that have to do with the newborn, of course you're gonna have OCD try to attach to the newborn because it's your baby. It's the most precious person to you. So it's of course you're gonna feel, but what if, right? So it's just saying, okay, now OCD has attached to my baby and that whole situation. What I'm going to do is any fear that is overwhelming, I'm going to treat as an OCD thought. Also another kind of way you can do this is, would somebody else worry about the same situation? Because as a new parent, it might be, well, don't other people worry about it? Well, if other people are not worried about it, then you shouldn't be worried about it. And just treating it like this. It's still a very new situation, so it's not so ingrained in your mind to worry about the baby. So it's like in an OCD way, right? So it's easily fixable, but you need to pick it up now before it becomes a giant theme, a new giant OCD theme. So as much as possible, trying to distance yourself from the thoughts. Yes, they feel very severe. It's about someone you care very much about, but there's still OCD thoughts, and you always have to bring yourself back that no matter how real it feels, it's still my OCD theme. I'm still refusing the reaction. As much as possible, I'm refusing the reaction, I'm moving on, I'm choosing to disregard. And just pushing through this way. This theme is not different than any other one of OCD themes. It doesn't matter if it's this or something else. It's just your reaction that matters. The more you react with fear, the more thoughts you get. This next question is, or next statement. At times I find I'm doing things that my mind tells me to do, and it's almost like I want to do these things regarding my OCD. But after I do something, I feel bad, and then I start to worry that I meant to do this and I wanted to because I felt like I wanted to. And the urges and the feelings involved. The result is feeling bad and wondering, is this OCD? Physical responses as well. I know that this is difficult to understand and may trigger, but I don't know how to deal with these feelings. Okay, so any kind of physical responses is a part of OCD because your mind is controlling your feelings. It's also controlling your body. So anytime you're having a physical response, whatever that may be, it's still an OCD thought. Don't take it more seriously because now you're having a physical response. It really doesn't matter. It doesn't make any difference. I see it all the time. You recover, it goes away. It's only there because you're so scared and you're so powering it up. That's the only reason why it's there. And then also, when what you're saying is trying to figure things out, the more you're analyzing, I can tell you guys with pretty much most of my clients, I would say, the biggest problem is analyzing. analyzing, trying to figure it out. It's the mental aspect of solving is the biggest problem in recovery, because if you compare it to physical compulsions, if a person is doing some physical compulsion, for example, they're washing their hands, well, they have to say they're sitting on the couch and they're going to get up and wash their hands, right? Or they're in a different room, they're going to get up and wash their hands. There's physical time that goes between those two events, so they have to actually walk over to the bathroom to wash their hands. It takes a little bit of time and they can stop themselves. With thoughts, you instantly have to react correctly, and that makes it much more difficult to stop yourself. And also because the thoughts feel so real, it's hard to refuse, because again, it feels like it's valid, but it's not, because it's like that for everybody who's having an OCD thought. It always feels real. It always feels valid. So next question is, hello, Ali. I'm suffering from 6 to 7 months, and it has already been more than 4 months. I found your channel, and since then, I've been doing disregarding the thoughts, but it's not working. My mind chatters every minute with OCD thoughts. Okay, so the thoughts are still going to be there. It's your mind has now learned that these thoughts are important to you because you were powering them up in the past. So as you start to do the right thing, it doesn't mean that instantly the thoughts are going to go away. Because say you had 1,000 repetitions that the thought is important, right? 1,000 times you took the thought seriously. You said to your mind, this is important, this is valid. And now you're saying, it's not important, it's not valid a few times, okay? It's not enough. So you just have to repeat the process. Your mind will catch up to this new programming that you're creating, but it just takes a little bit of time. So, and you have to be consistent. If you're one time saying, yes, it's important, and paying attention to the OCD thought, then saying, no, it's not important, I'm disregarding, and going back and forth, again, you're sending mixed messages to your mind. It's not a good thing. So it's just pushing through, and let your mind chatter. Again, we're going back to what I was saying in the previous shows, that it's over here, you're here. Your attention is zeroed in over here. It's not over there. Doesn't matter what your mind says, it's still your OCD theme. It has to do with your OCD theme. Doesn't matter what it's telling you. It's here. You're here. So, and just pushing through that way over and over and over again. And let it chatter. Who cares? And I'm just continuing to read. I'm tired of this. I thought this will be fine after some months, but it's not yet. Where did I go wrong? I think that maybe probably you're not doing, you're disregarding, but I think you're probably falling back a lot between disregarding. If I had to guess, that's where I usually see the stumbling blocks happen. So what you want to do ideally is disregard as much as possible, and then sometimes you have a setback, maybe just catches you at the wrong time, or something else stresses you out and you kind of didn't deal with OCD the right way when the thought came in. So that's fine, but more steps forward before taking a tiny step back, and then again more steps forward, so you're sending as clear of a message to your mind that this is not a big deal, I'm not reacting to this as possible all the time. That same message. I feel like I'm losing myself. Please help. I'm really in trouble. So yeah, that's what you do. Just day after day, just pushing through, and try to live as much of a normal life as possible, even if you feel like you're faking it. You will right now feel like you're faking it because you don't want to go out. You don't want to do things. You don't want to, for girls, I know it's a big issue. Like they don't even want to look nice or take care of themselves and probably guys as well, right? But it just more kind of bothers girls more. They seem to notice it more, that they kind of want to, but they can't, because it's like, well, I just don't feel good. And you just have to push yourself to do it, because if you're showing to your mind, look, I'm fine, I look good, I went out, I did this, and this, even though I felt really bad through it, I went and did it. that comes from a position of power. Your mind sees that, and the thought becomes less relevant, less important, and it starts to lose power, and then it continues to lose power until it's fully gone. So that's just the way you have to handle it. You get better at it the more you do it. It's like, it's one of those things that the first few weeks is the most difficult, but you just have to, like a tank, you just have to power through. So next question is, I seem super focused on needing a deep breath or needing to yawn. I don't know how to accept it or quit thinking about it, or quit thinking about breathing. Okay, so with this, all kinds of bodily functions and how the body works is an easy target for OCD. I see this type of theme all the time. There's nothing abnormal about having this theme. This has nothing to do with yawning or breathing or anything like that. This has to do with OCD. You're getting exactly what you said. You're getting super focused on this situation. To get out of this, you need to say, you know what? I'm going to breathe how I'm going to breathe. It might not be right. I might yawn, or I'm not sure like exactly what the fear is here. So I'm not sure if the fear is to yawn or not to yawn. But it doesn't really matter. Whatever OCD is telling you, the worst case scenario, you say, yeah, okay, whatever. I'm not paying attention anymore. And let what I was saying from the previous question. Let this chatter be over here, but not over here. You're hearing it. You're hearing your mind say, or you're gonna yawn, this is bad, this is whatever. Over here. Not in your zone of attention. So next question is, not sure if I'm supposed to ask my question here, but when I get intrusive thoughts, mostly I can handle ignoring them and treating them like any other thought, but at times they come in and I get really bad anxiety, and I'll have to go on YouTube to watch videos and look for reassurance. So that's the thing. You don't have to. Okay, it's a choice. You're either making a choice to do this and your OCD will get worse, or you're making a choice not to do this. You'll initially feel the anxiety go up, but your OCD gets better and you recover. It's as simple as that. Reassurance will always create more OCD. And guys, I'm being very serious about this because it's a very serious topic. If you continue to do reassurance, as good as it feels in the moment to get that relief, you're going to be stuck in OCD as long as you keep doing it. 50 years, 50 years, 60 years, 60 years. Until you make a choice to stop doing reassurance, you will have this. So you can make a choice now, you can make it tomorrow, and you can make it in 50 years. It's up to you, but it doesn't go away on its own. It just doesn't do it. Moreover, the compulsions become more complex. Especially with physical compulsions, the thoughts get more intense. So, you really have to push through and not allow yourself to do reassurance. No matter how it feels, how real it feels, how much it pulls you into doing reassurance, no more. You're not doing it. You're not following that kind of thing that you've been doing, because it just makes it worse. It actually makes the disorder overall worse, because it trains your mind to think that whatever you're worried about, whatever your theme is, it's very important, because you're reacting with a lot of fear, and your mind takes notice that, okay, for the whole month you reacted with fear to this. For the whole year you've reacted with fear to this. For 50 years you've reacted with fear to this. You have to change your behavior. But with all that said, I have clients who have had it for 50 years and they recover because they change the programming. So even after 50 years, it's not too late. It's just you have to start working on it, It actually changes fairly quickly. It doesn't take that long. All things considered, it's, even for that long, like for 50 years, it takes maybe somewhere between 6 months to a year. It's not crazy amount of time, all things considered. And look for reassurance and make sure that OCD is really what I have and not something else. Again, not doing that anymore. So is it normal if sometimes my intrusive thoughts bother me and sometimes I'm able to ignore them? Also, when I have really bad day, my thoughts, what should I do at the moment? So it is normal. what's happening is that you're reacting. The more you're reacting, the worse the thoughts get. So if one day you're choosing to disregard, you're choosing to do the right thing, ignore, you start to feel a little bit better. Initially worse, but then better. But if you're doing the wrong thing and you're falling into reassurance, you start to get worse. I hope the video is not blurry, because I'm looking at it, it looks a little blurry. I move my head a lot when I talk, sorry. So, but it's just about pushing through. No more excuses, no more reassurance of any kind. This cannot happen, because the more you do it, I'm telling you, the worse you will get. You have to refuse. Take all of your strength and refuse. Next question is, and this is the reason why kind of I took so long to answer this question, is because this is such a common question. This is how it goes for everybody. It's that, I remember it for myself when I had OCD as well, that it's like you'll give anything away just to find this one answer to this one problem of the day that you're having, and it's just choosing not to. It's just choosing to push through and choosing not to. So next question is, your videos like this makes me feel like my OCD is a fun game rather than a debilitating disorder. Thank you so much. I am so grateful. You're very welcome. But it's not like, obviously it's not a fun game, but it does have that mathematical equation sense where if you do this, this is the result. If you do that, that is the result. It's very much the same, no matter what theme the person has, no matter what the situation is. Reassurance, say you're starting to go down, makes it worse. You don't do reassurance, it makes it better. So it's always the same in that way. So many nice comments, guys. Thank you so much. I'm really happy to do this, and I hope my earlier speech of the video didn't kind of make you guys feel bad or anything like that. It just, it's like, I just don't know what I can do to help the situation with email, because it's out of control, to be honest with you. So if you have a question, just put it on here. You can make it as vague as you want, to not draw attention or whatever, if you want to remain, but it's pretty private, like nobody will know that it's you anyways. So, but I just, I don't have time to answer everybody's questions, because I am in sessions 8 hours a day as is, so this is between sessions. I'm filming between sessions. I'm going through emails and doing the rest of it. So just, you kind of have to understand. Next question is, hi Ali, I'm on board with everything you are saying. What I'm not clear on is that if you believe setting up exposure sessions that goes along with response prevention, where one is increasing anxiety for a period of time, is a good idea. If I believe that it's a good idea. I hear that that approach can speed up the process of recovery. As you know, OCD is very powerful, and those exposure sessions may be a way to attack with it and the power needed for the battle. Examples would be imaginary exposure sessions, or actually setting up real situations with someone, say with contamination OCD, with touching toilet seats. Your approach seems to involve what to do when OCD hits only. Now, no, that's not true. Okay, so in terms of exposures that happen naturally in life versus what I'm going to call forced exposures or additional exposures. So for things that are physical types of OCD, cleaning, contamination, all that stuff, adding exposures is very, very important. I will say that's 100%, and I do that with every one of my clients. So if we have a situation where a person is afraid to touch something, we go and touch it. So it's an on purpose thing. Sorry. This was not fun, right? Sorry. I talk a lot. In terms of the thoughts, with the thoughts, I don't feel that you need to do exposures. Pure type of OCD. Here's the reason. When you have a PRO type of OCD, or at least in parts, your OCD is PRO and then you have physical compulsions for another theme, right? The PRO stuff, such as harm OCD, you're already thinking about it 24 hours a day. And I have clients who have therapists who do imaginary exposures. It doesn't make a difference. The person who says to me, or even I've done that myself as well. When I was going through therapy as part of my recovery, and it was just silly, that's part of the reason I'm telling you, like, it doesn't work. It's just, if I'm thinking about something for 24 hours a day, what does it matter if I write it on a piece of paper or not? I'm already exposed to it. The thought itself, in PRO, say harm OCD, for example, is the exposure. The thought itself is the exposure. What are you going to do with that thought is your response. And if you prevent the response of fear, that's enough. With PRO, you're already exposed 24 hours a day. If you wouldn't be, you wouldn't be having a problem, right? So you're having thoughts coming in all the time. But with physical type of OCD, a lot of the times the person is avoiding. I'm not going to touch this. I'm not going to touch that. Oh, I'm not having an OCD thought because I'm not touching anything around me. And with that, you do actually need to put exposures. So that's kind of the difference. But setting up real situations, again, like contaminations and all of that works. But with PRO, you already have the exposure. You already did half the work, okay? Because the exposure is already there. Put it that way. But now you need to do the proper response. So it looks like I still have quite a few questions to get through, so I'm gonna do part 2. Also, some people were saying that they can't see the October 27th video, so I'm gonna check it out and see what's happening with that. Please check out the poll on youhaveocd.com. There's a lot of questions, actually a fairly interesting one. I'm gonna do a video on it also because the results are actually pretty interesting. And if you would like to do the recovery program, all the information is available on youhaveocd.com, so please check that out if you need to. And if you haven't subscribed, please subscribe. I'll see you in the next video. Thank you for watching.